It is Thursday night, December 15th. So we're right at a week out from my surgery that I had last Friday. So I promised you that I would make you another video if I made it out alive. Here I am. Congratulations to me. All right, so kind of what I want to do in this video is just go through the whole process of what happened during surgery and how everything worked here in Panama. So if you did not watch last week's video, that is part one. So that kind of gives you like the diagnosis information, how all that went, and all of that out of pocket through 3 different doctors here in Panama. And yeah, you'll want to see that. It's linked below. And while you're jumping down there to link to that, make sure you hit subscribe, make sure you click notify, and do not forget to join the IGO Panama Facebook group. Currently over 15,500 members strong. Over there answering questions, asking questions about anything, everything Panama, living here, moving here, visiting here on vacation. If you're doing something in Panama, you need to be on the IGO Panama Facebook group. Okay, so what happened from the time that I left you last time? So last week was literally, when I made the video, was the day I was having surgery. And as I explained in the first video, I'm not getting into my diagnosis and I'm not getting into all of my specific medical conditions. I did talk about the anemia that I had. That's a completely separate issue, well, kind of separate from what I had surgery for. So we talked a little bit about that, but as far as like all the specifics, I'm not getting into that. I don't like to put all my personal business out there, and it's really not relevant. Basically just the experience with the healthcare system here is what I'm trying to get to you. Okay, so we went to the hospital at 3 o'clock to the Panama Clinic, went up and got checked in. And to get checked in, I basically had to fill out a whole bunch of paperwork, just like you would at any hospital. There was a man there that spoke English, so he helped translate for the lady at the desk, and they just basically put papers in front of me and, you know, just had to sign this, sign this, sign that, give them my cedula, all of my information, sign off about blood transfusions, whether I would accept those or not, just basic kind of information. When we got to the end of that, then it was time to put the deposit down for the surgery. So I was originally quoted by the doctor. I was told that it's very interesting here in Panama. I mean, again, like I said in the last video, I hadn't had much experience with the US healthcare system, especially for anything major, but it's my understanding, and Brian, you can back me up on this, that you kind of, I mean, you've got 900 million bills, but the doctor doesn't bill you separately from the hospital. Isn't it all kind of under one umbrella?
It really comes under one umbrella.
Okay, he's had lots of surgeries.
And everything gets submitted to the insurance company first, so
Okay.
you don't see anything until you get to your deductible.
Okay, perfect. Okay, so here it works a little differently. Now, I want to state that here in Panama, you kind of have 2 separate health systems. You have the public healthcare system. So that's where most of the Panamanians are going to be going that are on like normal Social Security type things. Again, I'm not 100% on how all that works. I know that when Popsy hurt his eye, he went to a public hospital and all of that gets submitted to Seguro, which is basically kind of, I guess, like Social Security sort of thing. That's the money that I pay in every pay period to the government for him. So how all that works, I'm not sure. But I think the vast majority of people go to the public hospitals. So you're going to definitely get, you get good care there, but it's a public hospital. I think I mentioned last time, no, maybe I didn't. When Popsy was in the public hospital in David, there were 8 people in his room. 8. Okay, so then you have the private side of healthcare here in Panama, and that's what the Panama Clinic is. That's all private. Pacifica Salud, which I went to for the beginning part of my diagnosis, that's also all private. It's under Johns Hopkins Hospital out of the United States as well. So just keep in mind that you have two different healthcare systems here. Obviously, private is going to cost you more money than going into the public system. As a resident of Panama, you can go through the public health system. You're still going to pay. From what I understand, it's going to be normally less than what you would pay at private. You just have to weigh how you want to do that. I wanted to go private for everything, so I'm at the Panama Clinic. All right, so I had been quoted by my doctor. Oh, and that's what I was saying. Again, I'm not scripted, people. It's just all off the top of my head. The doctor sends you a bill for the private sector. So the doctor has one bill, and that includes him, his team, the anesthesiologist, like all of that. And then the hospital charges you a separate bill. So that's for, I guess like rental of the operating room, and then like any medications you need, the nursing care you receive while you're there, staying overnight in the hospital, like all of that stuff. So that's separate. So when I was at the desk, I had to put a deposit down, and my doctor had originally quoted me and said that it would be about $4,000 to $4,500 for the hospital part, and I had to put down a deposit when I got there of $2,200. So that's kind of where we were. And then they basically said, and I paid it on my credit card, and they said, okay, if it ends up being more, then we'll bring you a bill at the end before you go home, and you can pay the additional. If it ends up being less, then we'll refund you. That seems fair to me. Okay, so did all that and sat out in the lobby waiting for them to come and get me. They said they would come and get me at 4 o'clock, and a little after 4, man comes with a wheelchair, plops me in it. I tell Brian bye, and off we go up to the operating area. So once I got into there, I had to, it was so cold. Oh my God, it was so cold in the pre-op. So cold. So I had to strip down and put on one of those hospital gown things, and booties on my feet, and a hair thing on my hair. And then the lady took my blood pressure and weighed me and took my height. So she did all of that. So that was kind of the check-in. She didn't speak English. Whenever I was dealing with an actual doctor, they spoke English. When I was dealing with the nursing staff or anyone else like that, they did not. Again, it's just like anywhere in Panama, it's pretty simple kind of communication, so you know what you need to say and do. So it wasn't difficult for me because I do speak basic Spanish, so I got by no problem. All right, so they walked me into the pre-op area. There were a couple other people in there. There was a recovery area, so we walked through the recovery area into the pre-op area. Clean, modern, did I mention clean? Holy moly. It was immaculate. I was really impressed. So they put me on the stretcher and gave me a blanket because, like I said, it was so cold in there. But the blanket was really good. Kept me nice and warm. They came and put my IV in. They tried first in my hand. She was having a hell of a time trying to find a vein. She couldn't find one in my hand. Then she came back and finally, again, it took forever. She found one in here. Not because she was a bad nurse, just because I think I was so cold. Because I told her that, mi sangre es hielo, my blood is ice, because I was so cold. So she got that put in, and they started me on a drip. So they had me on just an IV drip and then an antibiotic drip. So I laid there for a while, and then the anesthesiologist came by, and she spoke English, and she was so nice. She explained everything that was going to happen. She said, I want you to know exactly what's going to happen. A, B, C, D, and then we're going to do this, and then you're going to do this, and then this is what's going to happen because I don't want you to be scared. She was amazing. So then after she left, Dr. Gutierrez, who's my doctor, he came in and talked to me a little bit about what we would be doing. he left, and not soon after that, someone came and got me and wheeled me through. And I remember there was a big digital clock up there as I was being wheeled down the hall, and it said 5:12. So at 5:12, I went back into the operating room where I thought pre-op was cold. If you have ever been curious as to where they store all of the igloos and snowmen in Panama, it's in the operating room at Panama Clinic. It was so cold. I was shaking. And I was shaking so hard. I was like, oh my God, this anesthesiologist is about to put a needle in my back, because she was doing like a double, I don't know how anesthesia works. I've never had it before, but she was doing like a double thing. And she explained to me that one would be a needle in my back that was going to basically take me from, rib cage down and numb everything, and then a general on top of that. So general would be in the drip, and then she'd do needle in the back. I was so cold and I was shaking, and I was like, this woman is going to paralyze me because I'm shaking so hard. And she said, are you cold? I was like, I'm freezing. And so they actually got me a hot blanket, so some kind of blanket that was like a heating kind of device that they put on me. That all of that took place probably within the first 2 to 3 minutes. The anesthesiologist said, okay, I'm going to put the drip on you. So she hooked that into my IV. And then the next step was going to be for me to sit up, so she could put the needle in my back. And she told me that my legs would get tingly, and then we'd sit back. And the last thing I remember is her telling me to sit up. I don't remember ever sitting up. I don't remember ever getting a needle in my back. I don't remember anything at all. Wow, if you've never had anesthesia, I'm not a fan. I mean, obviously I don't want to feel my surgery, but oh my gosh, the time you lose, it's crazy. So the next thing that I know where my time clicks back in is actually the next day. So I had my surgery it started at 5:12 on Friday night. I don't remember anything until the next morning, Saturday morning. But Brian says that they brought me in about 8:30 or something?
Yeah, 8:45.
About 8:45. So I don't remember being in recovery. I don't remember anything. But Brian was there, I guess, in the room. Apparently I had conversations with him. I hope he didn't make me sign anything. Apparently I was texting, WhatsApping people. I don't remember any of it. Okay, so Saturday morning when I woke up, I had no pain. None. And I was very shocked by this. And so this is really important for you to understand. And this impressed me so much. The doctor, the plan that we had originally discussed was not the maximum invasive process that could be done. It was the next step down from maximum invasive. So, and I was happy with that because I was like, yay, it's not maximum. I didn't realize there was something underneath that. When he had originally examined me, he told me we were going to be here. But once he got into the operating room, he was like, oh, we can take this down a notch and be even less invasive with it. So I ended up having an amazing procedure. I have no pain tolerance whatsoever, none. And the entire time I was in the hospital, which ended up being 2 days, they kept bringing in bags and asking me, Dolor, pain. No. I took one aspirin the day I left the hospital because I had a headache. Okay, he was phenomenal. I mean, miracle worker is what I called him when he was in there Saturday. Now, originally I was supposed to go home Saturday, except the problem being that I had, I was throwing up all day Saturday. So if I moved like this, I would throw up. If they brought food or water in and I saw it, I would throw up. If I thought about it, I would throw up. So I really didn't eat for 2 days, the day of the surgery and then that next day because I was so sick. And they were giving me IV meds for nausea. Finally, they gave me one that actually really worked. I could actually feel that one going through. It was the third one they gave me out of 5. So we eventually got it under control in the afternoon, but because I had been sick for so long, they wanted to make sure that I was stable before they sent me home. So I ended up staying another night. Okay, so what was the stay in the hospital like? Okay, Brian took some film, so we'll insert that right here. I know this is a long video, sorry. So we'll insert that right here.
Happy Friday. This is actually Sunday, December 11th, 2 days after my surgery. I'm in the Panama Clinic and I am doing great. And I'll sit down and tell you all about everything that happened when I have a little bit more strength. But right now, I just want to show you this hospital. I mean, I've traveled the world, and this is fancier than most of the hotels I stay in. Just check out this view. I don't know, what floor am I on, Brian?
We're on the 16th floor.
So we're on the 16th floor.
Panama City has one of the best skylines, I tell ya.
No joke. Okay, so let's give them a little tour. I haven't gone this far. So, a little lobby area. Look, even for guests, they have like coffee and tea and things. One of the nurses' stations.
Do you want to do the full loop?
These?
Yes.
Okay, yeah, we can do the full loop. I'm feeling like a champion today.
Nice view of the Pacific.
And so we'll make it back down to the end of this hall and then head back and I'll show you my room. Okay, so I'm finished with my morning jog. I want to give you a tour of the room. Let's start in the bathroom. I have a completely private room, which is utterly amazing. When I took Popsy to the public hospital in David, there were 8 people in his room. It was crazy. So there's a nice big shower, there's a toilet, and look at this. I'm excited about this. They give you a fancy little bag with all these toiletries. I'm telling you, it's like being in a hotel. But they come and, jab you in the middle of the night with things. So, this is the bathroom. And this has been my bedroom for the past 2 days. Comfy bed, they got phone, they got a nurse's button, and the nurses come like immediately as soon as you ring the bell. It's not more than like a minute, which is amazing because my son was in the hospital in Los Angeles and he was way more serious than I am, and we would have to ring the bell and eventually just go find somebody because they wouldn't even answer. They bring food, so it's like hotel with room service. I get my BBC World News. So they've been bringing food. They brought food 3 times yesterday, but I wasn't able to eat. Yesterday was a bad day. This morning they brought me breakfast. It's very good. I ate it. And again, I will say when I had Popsy was at the public hospital in David, that was one of his big complaints, is that like all they fed them was rice with like a couple little strips of meat. So like breakfast, lunch, and dinner. I mean, here you get full on good food. Not that I've been able to eat all of it, but I've seen
dessert.
It looks good. Well, you've been eating it. Yeah. And so, and so there's a little seating area here, again, with a beautiful view. They were going to let Brian spend the night if he wanted to, but we have our dog with us, our small dog. So he goes back to the condo to sleep at night. But yeah, everything here. Oh, and show them my little sign. So they have your little care plan up there with all of your information. Now I will say that like the nursing staff, they are not speaking English. So, I always say you don't have to be fluent in Spanish to move to Panama, but good grief, come on people, at least have some basics, some basic vocabulary. So I mean, they come in quite often and ask me if I have pain, dolor. No, I've had no pain. We'll talk about that a little bit later. And then they just kind of tell me what they're doing, and then sometimes I don't understand and I just say no entiendo, and then they'll just rephrase it in a different way so I can understand. When I was going into the operating room, we were using Google Translate with the nurse there. The doctor though, the anesthesiologist, all of those people speak English, but when I have a little bit more strength, I'll sit down at the condo and tell you all about those experiences. For now, my doctor should be here in about another 30 minutes, hopefully to bail me out of this place. Not that it's a terrible place to be, but I'd rather be in the condo. All right, so next time I see you, I'll be 53 stories up in the White Tower.
All right, so the room was spectacular, like a hotel. If I pushed the nurse button, like especially when I was throwing up so much. Oh, and they got upset with me because I would throw up, like when Brian wasn't there, I would throw up and then just set it like over to the side because I don't like to bother people. And then they would come in, they'd be like, no, and I learned Spanish. The verb for to vomit is vomitar. So vomito constantly. But when I would throw up, they wanted me to call them as soon as I did. And as soon as I would push that button, I'm telling you, if it took them 2 minutes to get there, I was waiting a long time. Usually it was in less than a minute. A nurse was in the room with me. They were phenomenal. Again, the nurses don't speak English, but it's fine. If you have that basic Spanish, you do not have to be fluent in Spanish to live here, but you really do need some basic understanding of the language, especially if you're going into a situation like that. So you can at least communicate a little bit. You know, dolor, it's pain. Okay, you need to know what they're talking about. And then you'll pick up new things. Vomitar, to vomit. Okay, so you'll get there. But I was able to communicate, you know, like, no, I don't want food. No, I don't want drink. You know, no, I don't need pain meds. And then they would come in and give me IV antibiotics at night. And during the day, too, they would come in and check my blood pressure, check my temperature, probably every few hours or so. They would do that at night also. But the great thing was, being in that private room, I could actually sleep. So I wasn't hooked up to 10,000 beeping machines. I just had my IV. That was it. So they would come in and wake me up, but because there was no noise outside, well, there was one baby crying somewhere on the floor. But all in all, I'm telling you, it was like a freaking hotel stay. It was amazing. Amazing. The staff there was unbelievable. And so my doctor told me that I needed to walk. So I think Saturday afternoon we walked a little bit, Brian and I, and we went into the hall, and like the nurses are right on me. Like they don't even want just Brian walking with me. Like one of them wants to walk beside me. And then the next day we went out and we walked, and it was the same thing. They wanted to be right beside me. So bottom line, like if I have to, describe the experience in the Panama Clinic, oh my God, amazing staff, both the hospital and my doctor and anesthesiologist, just unbelievably attentive, caring, wanting to make sure that I'm doing okay. Amazing room, amazing facilities, clean, modern, just everything you need. And like I said, he went less minimal than we had even discussed. I don't know that would happen in the States. Maybe it would. Maybe I'm jaded because I'm so kind of anti all of that US stuff right now. But yeah, he's changed my life. Like, I've gotten angry a couple times because if you watched the first video, you know that I was misdiagnosed in the US and I suffered badly for almost a year and a half because of stupid misdiagnosis in the United States. My life has changed so much just in the last week. Like things I didn't even know this was affecting. Now I realize, oh my God, that was affecting this, and that was affecting this, and now this is normal, and this is normal. I'm telling you, I would not, like I said, I could have gone to the United States and done this. I'm so glad that I chose to stay here in Panama. Okay, so bottom line, the doctor and anesthesiologist, his team and everything, $4,000. The hospital portion, I put that $2,200 deposit down. Then because I had to stay an extra day, it ended up being right at 4,000, right, Brian?
Right.
Right at 4,000. I'm no promises on. It's probably not going to happen. No, it's not, because I'm going to have time to do it. But I have my invoices where everything's detailed out for the hospital. I will post that in a link on this video, but it won't be the day the video's uploaded. It'll be, I have to get back home and deal with all that. So either come back here and check in about a week, or make sure you're on the iGo Panama Facebook group, and I'll post it when I post the link over there. And then you can see the itemized billing from the hospital, exactly what they charged for everything. Obviously it's in Spanish. So we're talking about a little over $8,000 for my entire operation. And I've done research that same operation in the United States with no insurance would run me between $20,000 and $40,000. That is a huge difference. We're going to submit all of our invoices to Brian's insurance because they're supposed to pay 50% of if we're like out of network. So we're hoping that that's going to happen. Then we'll get 50% of it back. And then I'm telling you, it's totally worth it. Like totally worth it. Just the what we would have spent in plane tickets going back and forth to Miami, and then having lodging there would have cost us what the operation cost here, and the care wouldn't have been anywhere near as good. I believe that with all my heart. Okay, so tomorrow I have my checkup, and then we'll be leaving Panama City. Things have changed a lot. This episode in my life that I've been living for almost 2 years has changed my way of thinking on a lot of things. It's changed my priorities on a lot of things. We'll be talking about some of those in upcoming videos. But for now, I am doing great. I am doing 1,000 times better than I ever thought I would be able to do. I've actually been able to do a little work a couple days ago. So yeah, that's my medical experience in Panama. Not really videos that I wanted to make, but since I had to go through it, I figured I might as well bring you along and let you kind of see how it worked. I realize this video is long. I apologize for that, but...
And you mentioned nothing about being the worst patient ever.
Was I the worst patient ever?
Not ever, but you're a little bit difficult patient.
How? What did I do?
Well, you want to be up doing wind sprints right now and, hiking the volcano, and since you feel no pain, but...
Well, that's not being a bad patient. I thought you meant that I'm giving you a hard time.
No, you're not giving me
No,
a
I'm
hard
not
time.
giving you a hard time. No, I'm a good patient. I've been sitting and just doing my little walks and things like that I need to do. I'm tired. I'm not gonna lie. I'm tired, which is probably why I'm rambling a lot, because I really am very tired. I've been tired this week. Pretty exhausted, but getting through. Okay, I'm gonna shut up and let you go on about your lives. So next week, I don't know what we're doing. What are we doing next week? Maybe the Airbnb video, I think, or
Yeah, possibly.
maybe, I don't know. We're staying at a beautiful Airbnb here in Panama City. I want you guys to see it. So that's
And we're
coming up.
creeping up on Christmas videos, too.
And we're creeping up on Christmas videos. We took some Christmas videos around Panama City, so that's going to be fun too. So make sure you subscribe. Make sure you click notify. Make sure you join us over on iGo Panama Facebook group. And I will see you next week.